Which will be the professions of the future in Latin America and the Caribbean? You'd probably expect the answer to this question to include jobs with sophisticated names such as data architects, robotics managers, cloud engineers. But did you know that in the future we will also need teachers, doctors, and nurses? Unlike jobs in many other areas, jobs in the social sector are unlikely to be automated because they require a set of people skills that artificial intelligence cannot easily replace. If current trends continue, the region will have close to 3 million doctors, 8 million nurses, and 12 million teachers by 2040. Where do these numbers come from? If we look at what has happened in other countries that have aged sooner than Latin America and the Caribbean, such as the United States or Spain, more doctors and nurses will be needed in the region to serve an increasingly aging population. In 2040, 1 in 6 people in the region will be more than 65 years old. Meanwhile, people will live longer, and many will reach a post-senior age, needing even more care. Also, even though there are fewer school-age children, more teachers will be needed. The number of school children is expected to increase as a result of expanded educational coverage and enrollment. Countries are also expected to continue reducing the number of students per teacher, matching their standards to those of more developed countries. And that isn't all. These are not only professions of the future. Jobs in the social sector are also thriving in the present. Why is this? In the last 50 years, jobs in education and health have steadily increased in Latin America and the Caribbean. And, compared to other jobs that require similar education, such as lawyers, engineers, or architects, their income has increased more in the last 2 decades. Teachers, doctors, and nurses are more likely to receive a pension in old age. Also, 3 out of every 4 education and health workers are women. The gender wage gap is considerably lower in these sectors than in others. How can the region's countries face this growing demand for education and health professionals, considering that many of them have not yet begun working, and some have not even begun their studies yet? How many doctors, nurses, and teachers will your country need in the coming years? Find out in our series about the future of work in Latin America and the Caribbean.